about to stress and stroke. This is major at present scenario. The stress and the stroke is directly proportional each other. It's increasing very faster way. What is exactly the stress? How to differentiate between the regular thinking and the stress? Suppose any things which articulates in the brain does not disappear or erase from the memory, we call term that is called the stress. What it does, it is brain. Suppose you think, you don't express to that one to anyone, you don't get solution for that, then what happens? It will just keep on activating, make engaging your brain cells. So then what happens? As usual compared to your regular routine work, then what happens? Even this one, some part of the brain will keep engaging what you are internally, what you were thinking, what are you this one previously, or you just took it, thought about that aspect. So one part of the brain keeps on just articulating that program, even though you will be engaging in some other kind of task. So that is called stress. Suppose if you think something, you do find a solutions or you express that way, then you will feel relaxed. So that is called the thought process. Or you will express something, you got resolution for that. So that does not any kind of, it is that functional things, it does not get articulated in the brain, but even also when that activity has already been processed. But stress, what happened? It will think consecutively number of times about one single aspect. So your brain gets engaged to that all the time. It's not only the last time I thought about yesterday, that was the matters. So today I just ignored it. Even also you try to ignore it, but it has not gone from your brain, this functional activities. So when any other activities simultaneously, if you just keep on building like this, which neither you get a solution for that functional things which you thought it, which is that event, or you did not express it. So neither resolution nor expressions. So that kind of thought process, that event or a multiple events or a single events will talk as a stress. So that means you'll have the single events. So the functional capacity of this brain will be minute. You will have a multiple event of the stress. Suppose example you take your personal or professional or family. So multiple aspect. Then what happens? That will just keep on ruining 24 hours. Suppose you might have little bit of professional things. Once you entered your workplace, then you will have little bit of stress, then you will come out. You just get relaxed, that is maybe for temporary. But you will have multiple events which is just getting articulated in your brain systems. That always takes part of the brain which participate in the articulations. So then what happens? Even also you will inactive, you isolated, if you are sitting alone, your brain consumes lots of calories for that. because brain already executing some kind of function, even also will be on rest. So brain signal don't get rest completely. So the event which is already processed, getting processed inside our brain. So day by day, it is becomes weaker. So when it gets weaker, obviously to other kind of activity when you do it is the brain needs calorie for to execute that functions. So that time what happens it is demand excessive of your blood circulations charge compared to the normal things. Then obviously heart has to pump more. So when heart this pumping is more, the pressure in the vessels will increase it. So when the pressure will increase, then the vessel's wall that can chance of getting ruptured because it has some pressure to load. So that gives it sudden this one rupture of the vessels which causes hemorrhage. So that is called hemorrhagic stroke. Even though previously only depression used to cause only ischemic stroke, not hemorrhagic stroke. Because ischemic stroke. So present is this one hemorrhagic stroke is very increasing because of the high stress. So today along with this I will just give a case presentations which is recently co to this one. Its age is almost, it is a 31-year male. He has almost past 15 days. He was having very bad stress about his both professional and personal things. Then he came out in the emergency. It was completely left side, completely weakness, and his speech is very low. He is not oriented. There is no other history of medications. He is not a hypertensive, not a diabetic, and previously no other medical complication also. Then the other parameters is under normal, this CBCs and ESR, everything on normal parameters. Yeah, vitamin D is a little less. B12 also is mild low. And its BP was 175/95. Then we have taken on this MRI. So MRI shows it's a mass hemorrhage in the right vitamin regions. You can just have a look at that. And the disease was E2, V1, M1. So even though such a high risk, he was almost rejected in previous 2 hospitals for the same reasons, and the patient has to go undergo surgery. There is no other treatment, and we cannot give the chance of survival. So then they came directly here. So they did not, patient attendants did not want to go for the surgery, and it's a mass hemorrhage. So chances of survival is a little less. Patient attendants did not want to go surgery because its age is less. Then what is the alternative for this patient? So we cannot give up. As a doctor, no. This is the only option is available, we have to go for that. Patient attendants did not want to go for that. So we cannot send back patient to the home. We need to try it. That is our ethics. So I just tried it. Put this one in ICU. As you are in order of the coma stage. In the first stage, same Jesus was this one, the E2B1 M1. Then I put in cellular license, that's BD. Then manitals is BD. Then citicoline injections, that is BD. And anti-hypertensive drugs. It was BD for first day. For second day, it is BP skin normal. So when given anti-hypertensive, his BP was going low. So I have taken it anti-hypertensive drug just after 14 observations, but after that BP was maintaining normal. Even though the sensorium was remained same on the second day and third day. On the fourth day, there is little signal of this one. That's mild bit of increase. It's from GCS from 4 to 8 increase to 6. So there is a bit of hope. That's positive things. With I added this antioxidant. I reduced the mannitol instead of BD, put it to OD. Then on the fifth day, again this is GCSH U4P3M3. So it was good progress in the 2 days. Then on fifth day, we started little bit of mobilizations. On sixth day, the sensory GCS has already become 10. So then I reduced cellular license to body. Then on seventh day, GCS become normal without any other kind of disabilities. Speech is normal, limb movement is normal, and we've done review CT. CT has shown almost 70% reduction of the hemorrhagic regions and the hematoma size. So this is what is called the, even also the patient come on right time, I couldn't able to recover it. So stress is major cause for the depression. the stroke. So to avoid this, getting this kind of stroke, this patient got recovered. We cannot give assurance to every patient they can get recovered. Because this is a mass hemorrhage which is covers completely 70% of the cerebral hemisphere. अभी दोनों हाथ उठाओ. ये थोड़ी ऊपर. हाँ, दरवाजा खोलो. चलो दरवाजा बाहर. धीरे धीरे दरवाजा खोलो.
इधर मुंह करो, अपना मुंह इधर करो.
हाँ
सर
बस.
नमस्ते करो सर. ये इधर आओ. सर नमस्ते करो.
This is just I given a case of example 31 years age. So previously our perception was it happens about 50, 60. So stress can cause you high risk that can cause you lifelong disabilities or life threatening. So avoid what kind of things which gives you stress. So be relaxed. How much is possible you do your work. How much is possible keep smiling. Make happy. Make time for yourself. Keep smiling and